your clinic, you've restored health to patients from 38 states and 8 foreign countries. You've had a lot of people into your clinic. You are board certified in emergency medicine and osteopathic manual medicine. As a DO, that gives you sort of a medical doctor and a chiropractor kind of combined and then some. I know that's a weird way to put it, but that's the way I look at it. So you not only understand allopathic medicine, but you're into and working with any alternative medicine that is valuable, has a value to it, and works. So you want to do as much natural as you can, but not throwing out the baby with the bathwater, realizing that there is some allopathic medicine that may have to be used from time to time. Is that pretty accurate?
That pretty much sums it up, except for one caveat. Everything you said was accurate, but I want to expand that just a little bit. In that most of what I've learned in terms of using alternative medicine, as you would know, as most people would know it, using homeopathics and vitamins and supplements and kinesiology and acupuncture and all those other types of modalities, just because I'm an osteopathic physician doesn't mean that I was taught that in medical school. In fact, most osteopathic physicians' trainings are really no different than what an MD medical training would be, except you do get training in musculoskeletal medicine and you do learn how to do manipulation, not only the same type of manipulation that a chiropractor would do, but there's a large variety of other types of techniques that we use and are actually trained in our medical school training. But all of the alternative stuff that I've learned since then, since I graduated a long time ago, has been courses that I've undertaken on my own at my own expense to go places to learn what it really means to be healthy. In fact, when I first started learning about these techniques, I spent a couple of years being pretty angry. I felt that my dad spent all this money to put me through medical school and I only got a half of education, and the half I got wasn't the best half.
One of the things that they don't teach in medical school is nutrition. That's simply, if they teach it, it's sort of glossed over, isn't it?
Well, I remember distinctly getting 10 hours of nutrition in medical school. It was a 2-hour class for 5 days. And the thing that I walked away with, I can still remember to this day the most, was the doctor talking about the fact that natural vitamins and synthetic vitamins were the same, and that as long as you were taking a vitamin, that was all that was important.
And are they the same?
Well, absolutely not. I mean, synthetic things are plastic and they're made in a test tube. Natural things come from foods and are extractions from foods and are things that your body really recognizes and knows how to metabolize and use appropriately.
You've got an article up on your website, and you've got a couple of websites. You've got drtenpenny.com, which is absolutely excellent, and you've got the other one, Osteomed, OSTEOmed2.com. And the article is The Truth About the Flu Shot. The truth about the flu shot. We are hearing so much day in, day out. I have never seen anything hype so much. Now, we've got a flu shot shortage. They've used that before, Dr. Tenpenny. When you're looking at that, I'm listening to it, I'm going, yeah, they're building up a demand by saying it's a shortage. Lines going 3 blocks long. If you don't get your shots, you're going to be dead. Well, there have been 144 children die of the flu this year. That's not an epidemic, is it?
No. In fact, when they started keeping track of children dying from influenza, it was back in 2004 when the pharmaceutical company was putting on a very big push to get the influenza vaccine put on the pediatric schedule so that, number one, it would increase their market share. Now they could give it to kids starting at 6 months of age. And number two, when it's on the pediatric schedule and it's given to a child, they are protected from liability if there's any adverse reactions. So they started the same type of hype. It's amazing to me how soon we forget that this was the same hype that was going on in 2004, making parents rush out and vaccinate their children. It was the same hype that was happening in 2006 about bird flu. And oh my gosh, if you go to my website, if you go to drtenpenny.com, there's a button on there that says swine flu hype. And under that tab, there's one that says bird flu hype. That was an entire archive of news articles that I put together for months during 2006 when I was writing my book, Foul, Bird Flu, It's Not What You Think, and archiving all of those articles showing all of the hype about bird flu. And they were actually anticipating and hyping more death from bird flu than they were even from SARS. And so how soon we forget that this is the same cycle that happened with SARS and with bird flu and with getting the kids vaccinated in 2004, and now they're doing the same thing with swine flu. You would think people had never heard this before, and that they are acting like little blind sheep running around in absolute hysteria about what might happen if my child gets the flu. It just aggravates me no end, I guess you can tell.
It does. I watched a news program, and they led off the program with this woman whose child was like 18 months old and died of the flu. And they said, oh, if only could have waited a few days till it was able to get the shot, this death would have been preventable. If only they could have got the shot, the death would have been preventable. And this is what they're doing. They're dragging out this. It's that absolutely hysteria that they are just dragging before the people, and they're doing a wonderful job of it. More when we get back with Dr. Sherri Tenpenny for the truth about the flu shots.
Don't go postal. Erskine will be right back.
So why don't you just kick back and let's listen to Erskine overnight while I puff on my favorite stogie. Hey now, I wouldn't lie to you.
You have two types of flu vaccine. You've got the one that is given intramuscularly with a shot. You've got the other one that they shoot up your nose. Okay, the one that goes up your nose is a live virus. Excuse me, but giving someone a live virus, is that a good idea? Number one, Dr. Tenpenny. And number two, do they work?
Well, the thing about the flu mist that's really the most frightening is that it's a exponentially high concentration of inactivated viruses. When they say live virus, it means that they've taken a live virus and they've done something to it called attenuating it, which means weakened it. And the flu viruses in the flu mist, which is the nasal spray, have actually been weakened by a temperature-controlled situation. So that means that not all of them are going to be completely inactivated, and that some of them will be able to reactivate once they go into your nasal passages because it's 98.6 degrees Fahrenheit. The other thing is that those viruses can shed for up to 21 days, and it doesn't say that on the 2009 package insert, but if you can go backwards and look at all of the package inserts since 2004 when FluFist became available, it talks about being concerned about the shedding of the virus for up to 21 days. So all of these kids that are getting flu mist in the schools, and then they sneeze and cough and blow their nose, they're spreading those viruses around. We're getting reports from all over the country that these kids that got vaccinated with the flu mist, now they're having outbreaks 3 to 7 days later of flu where it's shutting down the whole schools. So there's an assumption that you said right before the top of the break there that people think because they get the flu shot or the flu mist that's like putting up an absolute protection that they will not get sick, and that is absolutely not true. It's not true by the CDC's own data. It's not true by any influenza information that's ever been published. You can get that shot and you can still get the flu.
Now,
so does it work?
Healthy babies. You talk about a review of 51 studies involving 294,000 children. Now, that's a big study, and there's no evidence that injecting children 6 to 24 months of age with a flu shot was any more effective than placebo. Are you kidding me?
I didn't make that up.
Gosh.
That is a research study that's actually been shown. And I think, I was listening before, I was waiting to come onto your show about the recommendations that you were giving. Those were all excellent. But above and beyond that, what people need to do is get a blood test to get their vitamin D levels checked. I'm actually doing some research this morning while I was waiting for your call here on an article that I'm writing about influenza and vitamin D. There's been a lot already written about it, and I was just going to post an additional part about it, is the fact that people that have vitamin D levels that are greater than 60 do not get sick. And when you get a blood test, there's always a range. And the range on that blood test, it says the normal levels are 30 to 100. So many times the doctor will say, well, your blood test is in the normal range because it's 31. That's not good enough.
Right.
That blood test needs to be greater than 60. They've shown that people that have recurrent colds, men that have heart disease, women that have problems during pregnancy, children that have allergies, asthma, and eczema, all of them have low vitamin D levels, and it's published in the medical literature. So, yes, it's good to take C and wash your hands, but you have to get your blood tested. And you have to take enough vitamin D to get your levels up.
On vitamin D, of course, it depends on how you test out then, doesn't it, the dose that you take?
Yes, but, there's a whole list of ways that you can take it. That's going to be published on my website probably by this afternoon or tomorrow of the dosages that you could take. And when you get a baseline, you start taking big doses of D, you should get your blood retested in 3 months. Now, the thing that's really important
that's on
if you don't want to go to the doctor's
tenpenny.com.
office and get that done, you can get it. You can get it done directly yourself. You don't even have to go to the doctor to get your vitamin D level tested.
And that's on drtenpenny.com where you're going to have that information. You've already got the information up there as to where you can get tested, and you don't even have to go to the doctor's office to do it.
Right.
Now, one of the things that you say, children with asthma, certainly don't give them the flu shots, right?
Correct.
And why not?
Because they don't work, and you've just increased the incidence of your child having a worse reaction from the flu shot because of the components of gelatin and 2-phenoxyethanol and formaldehyde and other things that are in the flu shot.
Now, what about the elderly? We always are hearing, got to give the shots to the elderly because they're the most susceptible. They're in the nursing home. There are 64 studies, 98 flu seasons, elderly living in nursing homes. How did it do for the elderly? Did it keep them alive longer? Were they happier? Were they able to gum more donuts as they went through life? Was it good for them to take these flu shots?
It, again, showed that this was studies that were done by the Cochrane Collaboration, which is a think tank that examines all published studies that were done on the flu shot. When they analyzed the data, they found that the flu shot was no more effective in any age group than placebo, than a sugar pill or a shot of sterile water, than protecting you and keeping you from flu. Because you could still get what's called an influenza-like illness irrespective of whether or not you've gotten the flu shot. The CDC has stopped testing for H1N1 viruses in nasal swabs because they've been so overwhelmed. So you can get other types of flu-like symptoms even if you get the flu shot.
They've stopped testing, but they're still calling it H1N1. That's where they're getting a lot of their statistics. Numbers keep going up, and who knows what it is. Could be H1N1. It's probably just another type of flu. Absolute. I mean, this is pandemic level 6 now. Don't forget that. Let's get scared.
Now, don't go getting your pantyhose in a bunch. Erskine will be right back.
Here at the retirement home, we always listen to Erskine overnight. It's all we got to listen to.
You can get either of Dr. Tenpenny's books, Foul, Bird Flu, It's Not What You Think, and Saying No to Vaccines, a research guide for all ages, by going up to her website, www.drtenpenny.com. You also can get vitamin D, or you can also find out where you can get tested at a very reasonable price for your vitamin D levels. And vitamin D, she says, is one of the critical things. If you get your vitamin D above 60, which is, I don't know what 60 means, but if you get it above this level that the doctors know about, then you're simply not going to run into a problem. Now, one of the problems with this is these viruses mutate. There are how many? 200, maybe 1,000 different viruses out there, and they're always mutating. But this swine flu vaccine, wasn't it patented a year before the flu ever hit, Dr. Tenpenny?
No, it really wasn't. That was one of the reasons for the big push that happened back in April when we suddenly poured almost $8 billion into the drug companies' pockets. They were doing the testing then, but the testing was only for 3 weeks. And what people have to understand is when they hear the mantra over and over and over again, vaccines are safe and effective, safe and effective, safe and effective. I mean, what that really means is nothing. Vaccine safety studies last anywhere from 5 to 21 days. It takes longer than that many times to come up with a side effect or a reaction. Effective only means that your body created